Up until 1989, all major operations in the belly and in the chest were done through large incisions which took weeks to heal and had complications all on their own, and the stress on the body was tremendous.
So that's what minimally invasive surgery has been all about, getting away from that open surgical incision and to multiple small incisions which drastically reduce complications for the patient at the cost of drastically increased complexity for the surgeon.
So laparoscopic surgery today, to do those motions externally, they're much larger motions, you're moving bigger things faster, whereas if with our device, because the robotics are small and inside the patient, the device that's actually driving that can also be small. And all of this translates to a simpler device that actually has more degrees of freedom, more capability inside the patient than any other system out there.
The Vicarious robot moves as the surgeon moves. The same way that when I move my hands, the Vicarious robot moves the way that I move my hands. This helps me to translate my thoughts of how I want to move the tissue into the way the tissue is going to move.
If they want to throw a suture and close a wound up inside the patient, they can do that just as easily with our robot as they can with their own hands. More proficiency means better surgeries. Better surgeries means shorter surgical times, which leads to better outcomes.
I think the next phase is going to come with utilizing sensors and different wavelengths of light with some artificial intelligence to help surgeons understand where vital structures are in relation to the operation they're doing now.
The long-term vision is to create this hardware platform as a facility to our software platform. If you can automate repetitive tasks for surgeons, instead of having to close a wound and suture, through every one of those dozens of sutures, if you can have a program do that for you and make it perfect every single time, that's obviously going to improve patient outcomes. We are really building something that it's going to help patients. It's going to make surgeons' lives easier. It's going to save the healthcare system money.
There are other cool technologies with great financial opportunities, but the way I view it is I have the privilege of also having the ethical opportunity here. The ability to really touch millions of patients' lives and take literally millions of patients from an open procedure to a more robust, better quality, minimally invasive surgical procedure. That to me is just, it's the perfect opportunity.